All right, let's get started. So welcome everyone to the December 2022 edition of the Cerini Connection. All year we have been talking about some pretty global issues, and today we're going to continue that trend and look at the current landscape of how we address the needs of people with disabilities, a system that historically has been flawed. Today we are joined by Charles Hammerman, who is the CEO of the Disability Opportunity Fund, a nonprofit organization that makes mission-driven investments in an effort to drive real change to this pressing issue. Thank you, Charles, for joining us today. I'm really looking forward to today's discussion.
Thanks, Ken.
So, Charles, before we get started, you keep going to witness protection there every time you move. So, before we get started, can you spend a couple of minutes maybe talking about the Disability Opportunity Fund and how you look to effectuate change through the fund?
Yeah, so one, thank you for having me, and thank you for everyone who's listening and participating. Disability Opportunity Fund, which is based here on Long Island, but operates nationally, is a not-for-profit. We are a community development financial institution, which means in essence, we are a investment and lending vehicle that, although we are a not-for-profit, sort of operates in a for-profit mentality. Sort of have four things that folks may not know about us. We do lending. We actually own real estate. We do venture capital investing. And then the fourth thing that we do when the opportunity presents itself is when a donor potentially will come to us and ask us to give out grants on their behalf to organizations, both not-for-profit and for-profit, that are connected to disabilities. We act in that role as well. So those are sort of the four things we do. In terms of technical assistance and public policy, we're very proud of the fact that we have just completed our 15th year of operations. And through the work that we do, we also get involved in public policy issues, both locally, statewide, and on a national basis, in all forms of the 6 focus areas that we've created, which is housing, education, employment, life sciences and healthcare, technology and products, and then socialization. So that's what we've been doing for the last 15 years.
What are the big public policy issues you're dealing with right now?
So right now is a continued focus on when we talk about housing, it's not about the physical housing. Right now, it's much, much more about services. And the fact that clearly through COVID and now the residuals after COVID, home health care is under absolute crisis. And while it's great to be able to physically put up a house, if you don't have the correct care that's going in for people living in the house, whether it's individually or in a group setting, the whole thing is going to fall apart. The second aspect is asset development, or actually changing the antiquated and archaic asset limitations that have existed for close to now, 40, 50 years for people with disabilities to qualify for SSI. We are very focused on that because that needs a big change. And really more of a big move to get government agencies to invite in the private sector to have a public-private partnership in resolving many needs. I don't want to call them issues, it's just pure needs for existing people with disabilities and sort of the next generation of what's going to be needed.
Okay, so public-private partnership is something that I want to touch on a little bit later. Let's start, first of all, with maybe this. The systems in place in New York State in working with individuals with disabilities. I would say, especially with the IDD population, they need to be revamped. I think we all kind of agree that there's some stuff there that's broken that needs to be fixed. What do you see happening around the rest of the country and other parts of of the United States with respect to this population, and what can we learn here in New York State or bring back here to New York State with respect to this?
Yeah, so obviously in prep of this conversation, I wanted to do a little look back of what we're working on right this second. So just to give the audience an understanding, we're not here to just keep proposing the problems. We're here to really look at and define problems with the solutions. And believe it or not, as of the date of this recording, Disability Opportunity Fund has been approached in 16 different states around the country to look at 35 different, when I say housing projects, again, it's much less focused on the physical housing, but to do these intentional communities or even single home situations. I would tell you that on the service side, believe it or not, California is doing an excellent job at this point. Again, is everything perfect? Absolutely not, but they're at least addressing the situation. And to answer your other part of the question, it's inviting the private sector to the table. They can't do this on their own. And they're inviting the family groups and organizations and even the private sector to come to the table and come up with joint solutions. So therefore, yes, it's going to still be government Medicaid dollars or Social Security dollars or state dollars. But it doesn't necessarily mean that the state of California is actually going to run the operations or do anything else. So I think there's a lot of creativity we're seeing in places like Indiana that we've been involved with for almost 5-6 years at this point. Private sector real estate developer matching up with the state of Indiana in terms of their deployment of resources on the service side, and they're thrilled because it's getting the results that they sort of need. So for our home state, we really have been preaching this literally since day one. For 15 years, we've been having conversations with them when they were still OMRDD and now OPWDD, that we really need to start addressing the methodologies and the models and adopting them from what's going on outside and trying to deal with it and address those needs here in New York.
So you talked about a couple of things there. I mean, you talked about intentional communities, you talked about the public-private partnerships, you talked about services versus physical housing. So there's a bunch of these concepts that you've kind of thrown out there, and let's kind of maybe explore a couple of these.
Sure.
So when we look at services versus physical housing, let's start with that one. I mean, I think everybody understands what physical housing is, but what are you talking about in terms of transitioning from more of a brick and mortar type model to something that's more service driven, and what's your thought process there?
No, that's great. It's a great question because we've been preaching this for 15 years. So we like to use the phrase, well, there are a couple of basic things in terms of the concept of housing. We've been trying to talk to the state of New York as well as anybody else who listens to us about what we call the 3 C's, right? Choice, control, and community, because at its bare core, every person deserves to be able to choose where they want to live, control their situation, and let them define what the community is. Don't let the government define what is community, because some people may like rural, some people may like urban, suburban, living with other people, living on their own, and such. And this attempt for decades of trying to pigeonhole people into beds or group homes or other kinds of situations just because we were able to get rid of Willowbrook doesn't work. You have to let the people decide where they want to live and let them control that. The second concept is what we have been preaching for 15 years, is bifurcation of real estate and services. Here in New York, there's still this sense of certified homes. Doesn't make any sense. There's the sense that there's very ill-defined Medicaid waiver discussions about, is it 4 people who are allowed to live in a house, 2 people allowed in a house, 22 people live in a house, and it's all over the place, and it's not being well defined, and it's not being sort of preached to, and a lot of it is really unconstitutional when it comes down to it in terms of the way the stuff is being handled and discussed. And it's not making anything better. So after all of these years, decades and decades, the abuse situations are still hitting the newspapers all the time. We are getting anecdotal phone calls about people who have loved ones in certified group homes, and it's just a mess. We have the not-for-profits who come to us and say they can't sustain the buildings anymore because of obviously the change in managed care and everything else. So the moment has come. Moment has always been there in our estimation, but it's really getting to this critical point where if OPWD in New York is going to sort of mandate and dictate what's going to happen in the future, then things need to change and have all the constituents at the table.
So again, I fully agree with you that there should be choice. I mean, everybody should have choice as to what their living arrangements look like, what their life should look like moving forward. And with choice comes, different ways of looking at it, different models, different, as you said, living arrangements and structure. What does that look like from a cost perspective, and where does does this come back to what you were talking about in terms of the public-private what do you call it, partnerships, in order to ensure that the multiple or different models that are out there are cost effective?
Yeah, I mean, from one aspect, we love self-direction, right? The concept, excuse me, when self-direction, I think they were calling it ISS or something at the beginning, and we were really preaching that should be grown, right? And then managed care came in and it became sort of mandated, and self-direction, became, okay, let's give the families or the person with a disability a budget and let them figure it all out. We like the concept. Obviously, there has to be more money, or there has to be more recognition of what services cost, especially in this inflationary, environment. And in a sense where it's very, very difficult to, sort of get resources, because, there's a very difficult labor market in terms of the service area. But in terms of making the dollars work, that's how we look at these things in terms of when people come to us, whether it's one single family home, or whether it's going to be an intentional community or an apartment complex that has 100 units, and they're going to set aside, 20 to 25% of those units, for people with disabilities. What you asked about public policy, well, that's why we worked also very hard on trying to get something like ABLE accounts passed, a number of years ago, because it's going to require planning. It's going to require multiple forms of, capital to be able to get things done. And that only is going to happen if everyone is at the table discussing these things and breaking it out from a business case and saying, okay, so what is it going to take and it's not just, giving everyone everything they want just because they're demanding it. It's getting the basic needs done and trying to show that there's a cost savings in the longer run, that if you invest heavier at the beginning and you create a good infrastructure on the service side, then it's actually going to be better in the longer term, because you're going to require, less services. And we've proven that. I mean, we've proven that here in New York with homes that we did with the Cardinal McCluskey services, up in Ossining. And there was a big fight about, a heavy duty budget up front to get more services for young adults who were transitioning out of a very intense program out of Boston from their autism program. And it was like, well, you're doing a transition. Of course, they're going to need more, services to be able to handle the transition. But as time would go on, then those services would lessen, because obviously you hope that everything would sort of move forward nicely in terms of them learning how to live in the community. So again, everything is going to require, and there should not be cookie cutter answers, right? Every single person in every single community is going to require their own specialized models. And that's why trying to create one universal, statement of saying, this is the only way it's going to get done, or you're not allowed to do this because it just doesn't work. It has to be individualized.
Well, I mean, different people function at different levels, and different people
100%.
have different needs, and different people have different lifestyles. And I think part of the problem that I've seen in the past is, you try to shove a bunch of different people with, different attributes and different needs together in a single facility, and it just doesn't work.
It doesn't, it not only doesn't work, but it's inhumane. I mean, the sense of the old style beds where if a bed was open, you can end up with a new 23 or 24-year-old living with an 82-year-old. Things just don't work. And again, I think also on a very positive standpoint, there are a lot of great models, both here in New York. I mean, we're seeing some incredible models here in New York and around the country that also are combining technology. And that's why we do the venture capital investing as well, because there's amazing technology that's going on that does support more independent living. Or I think the point you were trying to allude to was economies of scale.
Yeah.
Right, because the sense is that there's a tremendous way to utilize technology that would help reduce the reliance on physical, human beings, handling certain tasks. And that's where the economies of scale are going to go in, not going backwards to, well, the budgets are tight and it's inflationary, so what are we going to do? Go back to, institutions like Willowbrook? I mean, we have to go forward, not backwards. And this is not, and it's not a hobby. This is the other aspect to it. It's not a hobby, or this is not a constituency that needs to just sort of be ignored just because they're at the whim of the government. I mean, it's constituting, 20% of the nation population, and there is a lot of private sector money that's sitting on the sidelines. They're not being told that this is an issue that they should be investing in or doing something about. I think, it was always funny when I do these kind of talks, what's happening currently. And today's New York Times had a big long article about their Deal Book Summit that was just had. And they were asking, leaders from the summit to talk about the future. What's happening in the future for, what trends should be looking at. And here's this huge, big article. The word disabilities isn't mentioned once. So again, it's this really big concept of trying to, and that's what we advocate and try to do through our work, is try to get it front and center. And that's why we need this partnership with the government, because they're the ones with the purse strings. And we have to learn how to incent the government to come to the table and think a little more private sector wise, and look at the demand and figure out how we're going to address that demand.
There are just so many questions that pop up from what you're talking about. Just kind of maybe not in any strategic order here, but I'll throw some out. I mean, you talked about the ABLE accounts.
Yeah.
And I think part of the problem you have with the ABLE accounts is that the limits that are established for those ABLE accounts are just too small. And if you're looking to effectuate change and you're looking to allow families to help contribute and make a difference, those ABLE accounts have to be extremely expanded.
So one, totally agree. So let's go backwards to go forwards. As I always like to preach also, there are God-made rules and man-made rules, right? And the God-made rules is when God makes a decision that a specific individual will either be born or acquire a disability, you can't do anything about it. That's what God decided. Everything else we're talking about in this conversation, and especially with things like housing or Medicaid waivers or ABLE accounts, were man-made, right? These are man-made rules. They can be changed. They can be adjusted. The history of ABLE accounts, just so everybody on the call knows what we're talking about, ABLE accounts are these specialized accounts. It's supposed to look like a 529 account that is an ability for an individual with a disability, not through a trust, but to directly own an account, own assets that would be protected by Social Security, except its limitations is exactly what Ken's referring to. It's only up to $100,000, and there's a whole bunch of other rules that go along with it. Well, the history of that when before starting the Disability Opportunity Fund, I was on Wall Street. And as a parent of a child with a disability, there was a group of us that actually went to Congress, and we got very close to creating DSAs, disability savings accounts, where it was going to be as easy as walking into a bank, opening it up, no limitations, okay, literally no limitations on dollar amounts. At one point, the government was trying to come back and ask us for some form of, limitation. So we said, fine. And we were like $1 million. I mean, we were just basically saying, why create a limit? The whole idea here is that if the person privately or the family or anybody else was going to be able to save money privately, that would be able to be supplementing anything that they are getting from the government. That's the most beautiful thing. And we just they literally couldn't get around it at all. The way ABLE accounts came about was that when Congressman Crenshaw and Senator Casey, sort of one Democrat, the other Republican, tried to come up with something, they went then to the IRS, they went to basically the tax code, and then ultimately said, well, let's try to mirror it like 529 accounts. And all of a sudden it got very narrow and it got very limiting. Is it still an interesting concept? Yes. Is it being widely used? No, because it's not being marketed correctly. It's also
a lot of people just don't know about it.
And exactly, it's just literally not. And God bless, my constituent, my friends in the in Albany, who we've been talking to for literally years since this thing. Like, there's no advertising that goes on. There's no marketing of it. And really, we believe, and we ask and proselytize about it all the time with not-for-profits, that they should be getting families to sit down and at least consider it, at least look at it, because you could open it up with something as simple as $25, and it teaches how to save, and it could supplement. So the fact is that, again, it just because it's not the most perfect product doesn't mean it's bad, nor does it mean that we should stop, right? And we can continue to be creative and such, but these are the kinds of things that we're talking about. Private sector money supplementing government money to be able to tackle what's going to be huge, requirements, in the future.
And if the big fear is that, that's going to create that separation for the have and have nots, then you just make it so that if the haves put the money in, a portion of it goes into a pool that gets used by everybody, so that you have the opportunity for everybody to benefit.
Yeah, and not only that, Kim, but we literally have been talking to major foundations who would say, look, okay, so let's assume you get those truly low income who can't even afford, to put $25 in there. There are these major foundations that are focused on disabilities, and we're like, fine, then let's set up ABLE accounts, and we will put $1,000 or something into each account for people. So that way, then when the state takes over the investment of that account, it can grow over the course of years. And again, great tool, may not be perfect, but should definitely be more utilized 100%.
You also mentioned some of the changes in technology and some of the new technology in the marketplace. Do you want to talk a little bit about what some of that technology looks like and what some of the cool things you're seeing are?
Yeah, well, I'm going to be a little selfish and talk about one company that we're invested in, which may sound counterintuitive because it's not a physical product, but it's called Hiki, H-I-K-I, and it's actually a socialization, medium for people with autism and other disabilities to get to meet each other and get friendships. And you say, well, what does that have to do with housing? What does that have to do with care? Well, it's everything to do with it, because this is the future, right? And the fact that we're able to get people to connect through a platform where they're able to understand that there are other people like them that they can communicate with, that's not the more traditional, dating apps or things like that, has been incredibly powerful. And we have been invested in it for 2 years at this point. And when we got started, there was maybe a couple of thousand people, around the globe who were connected through this thing. And now they're approaching 100,000 members talking to each other. And the fact is that there's been zero acquisition cost on the customer side, meaning this is all word of mouth, all social media, all, well, that's big. I mean, that's where, again, we encourage the governments to understand that there's a trend going on out there, and there's a market going on out there, and people sort of can utilize technology to actually communicate and then get to another level, because while this started off as a socialization app, so to speak, now they're already being approached by corporations to use it as an employment app, and saying how they can look towards getting candidates for employment from the app, and getting people to apply for these jobs. Well, what does that mean? Applying for jobs means income. Income means that people with disabilities are going to be able to afford a better housing situation, or a better situation on the services side, and then all of a sudden that would reduce the pressures on the government in terms of having those people on any sort of a wait list or anything else.
Yeah.
In
So
terms of the
it's
actual
just real
homes,
quick. You're talking about really not just, you talk about housing, but you're talking about building communities, really, and that's what housing is all about. It's all about building communities.
1,000%. And I think, again, in terms of the technology of what we're seeing in housing, we're, again, as I said, we're starting to see companies, for-profit companies, coming up with these economies of scale by being able to manage houses utilizing sensors, utilizing cameras, utilizing personal devices that the residents can have to keep people on schedules, to indicate when things are needed and such. There's a lot of very, very interesting again, tech, medication, in terms of being able to deliver and dispense medication, versus having a physical nurse or a physical person there. Saves time, money, energy, everything else, and still delivering that sort of delivery service that the residents will need. So look, from our standpoint, again, and you asked about public policy or changes. Employment's a very big deal. We've invested in a couple of companies that focus on employing people with disabilities, and for us to have taken people off of welfare and watch them have $50,000-$60,000 a year jobs, and productive jobs in the tech field, and then buy their own first home or have their first car or do something in that regard. I mean, that's groundbreaking, and it's not anecdotal. This is trendy. This is now starting to trend, and we're very excited, to see what the future is going to bring.
So again, I think, talking about that also, you're talking about smart homes, smart appliances. It provides more freedom to individuals, gives them the ability to kind of live more independently, because you've got that ability to ensure safety and everything else, built in. When we talk about the spectrum, and there's a broad spectrum of where individuals may fall in terms of disability. Some of the concepts and ideas you're talking about now, do they really meet everybody on the spectrum? Or, are we still in a situation where, again, depending on where somebody falls within that disability spectrum, there's going to need to be more of a community-based, not community, but maybe different housing requirements than somebody who maybe is higher functioning?
Sure. I mean, that's an amazing question, and I'm just going to answer it with I'm going to sort of go back in sort of a little bit of history lesson of what we've been doing, especially here in New York, and technology. It ties in technology too. So think about this, back in, I guess it was 09 or 10, we got to connect with St. Mary's Children's Hospital in Queens, New York, which is probably one of the most amazing places that had to deal with the most severe medically fragile children. And even unlike the educational system, where you could at least stay in the educational system until about 22, there at 18, the Department of Health in New York sort of graduates them to adulthood, and they lose all their services. But you think back, and we talk about technology, you think back to when we were visiting the hospital and we were talking about housing, right? Post 18, housing and post 21 housing. Back then, they showed us how children would be in the hospital and have these big computers at their bedside in the hospital, so they could actually try to, talk and be part of a classroom. You're like, wow, that looks really weird. And it was, well, think back to what we just lived through with COVID. And what are we doing right now? We're on a Zoom call, right? Zoom. Now it's all of a sudden become part of the nomenclature. It's normal. It's, everything else. So back then we tried to go to the state of New York through Department of Health, because OPW didn't cover, that population, and tried to do a house, tried to do sort of a house. And if I tell you what the paperwork was, that what I would call the obstacles of what it was going to take to just make a proposal and try to get, agreement on things, was unconscionable. The point is that, again, I think that it's supply and demand. You asked the question about the spectrum of requests and what we're going to need. Well, we came up with a concept years ago where we came up with something called Wait No More. We came up with a questionnaire that we could go locally to each of the different regions within OPWDE and just start finding out what's the demand, and what's the demand at a questionnaire that would go from age, let's say, 19 to 23, then go from 16 to 19, 12 to 16, 5 to 12, to start learning where the quote unquote bench was, like who's coming up the ranks and what are they going to need, because we already knew what the demand was post 22 and such, right? I mean, that's where, whether there was a real official wait list, no wait list, whatever it is, we knew where the demand was existing, but what we were trying to figure out was where was it going to be coming from, and in the questionnaire talked about what families could contribute, couldn't contribute, to try to get an assessment of it, and then start attacking it from a demand to, okay, now where's the supply and how are we going to prepare for it? Unfortunately, it never got, sort of adopted, and the concept still exists, which is it's figuring out the demand and figuring out what's going on, either not just immediately today, okay, who's looking for housing and and that becomes the emergent and all the phone calls, and people become the squeaky wheels. I know this assemblyman, I know the state senator, I know the governor, I can get this. No, this should be much more organized. It should be fairer. It should be looking obviously at constituencies that don't have the resources, in low-income areas and where English is a second language. And really just, it's not that difficult. It's demand. You look at supply and you look at a solution on how to address that demand. It's not that difficult. It will be hard to ultimately get it done, but it's not hard to define what's needed. And it just needs to get organized.
I normally like to try to integrate questions that people ask into, but I have to read this one because it's, so you mentioned trying to change the archaic asset levels of benefit programs. SSI, for example, the 2000 asset level has been in effect since 1989. Has there been any progress with this? What about the incorporation of the EIPs, also known as the 3 federal stimulus payments, as a means to permanently increase the SSI asset level to something like $5,000? These funds are considered permanently exempt as an asset for MA and SSI purposes.
And that's what we're working, that's what we've committed ourselves to as our next big public policy move. So what we've done, and just so everyone on the call, that's a great question. And that's what we as an organization have committed ourselves to. So 15 years, we spent the first 10 years really trying to break down the public policy as around housing itself, and trying to get all over the country, trying to really fight pretty hard on this whole concept of what the waiver program means, and allow, all these very novel concepts of community living to be brought to the fore. And we think we've done pretty well. We also worked really, really hard to not be the only one trying to finance these things, because the banks wouldn't finance, very novel concepts um, on housing for people with disabilities, and now they are. So it's taken us 15 years, but the banks have become pretty good partners in understanding, where the risk levels are. The second thing that we've done over the last 5 years is employment. And we've worked very, very hard, not so much that there was a policy issue that needed to be changed on employment, but what we have invested in are a lot of companies to actually start hiring people with disabilities. And again, on that level, not just companies doing it as sort of this, patronizing, oh, feel good thing. No, this is a business model, sort of concept of what's going on. And also from the standpoint in the entertainment industry, if you look at commercials, if you look at television shows, movies, now all of a sudden there's talent agencies that we've been very connected with, and there's a great not-for-profit called Respectability that has a whole arm out of Los Angeles, to get actors and those in front of the camera, behind the camera, employed in the entertainment field. So now to this question, that's what we have committed ourselves going forward. And now that we're all out of COVID, and now we're getting back to being able to visit people on the Hill, we are going to be focusing on this in a very, very big way, and trying to understand how do we break this thing down. So whoever did have that great question offline, would be more than happy if anyone else has questions or thoughts on it, to connect up with us, because we're going to start putting a plan together in terms of how do we attack this, and try to just make very common sense solutions for the government to sort of look at this and say, okay, this is archaic, let's come up with something new, and let's not overthink this thing.
You must have mentioned throughout the last 35 minutes at least a dozen times, private funding, private partnerships, and everything else. What are you seeing out there from a private partnership perspective? Some examples that you're seeing that are like, this is the way it really should be. This is, these are great partnerships that are working effectively.
So we are actually seeing for-profit real estate development companies who are approaching us. Remember, just let's think of the arc. You talked about the spectrum and the arc of disabilities. Let's think about the arc of the economy. Okay, we started this thing in in 2008, and everyone on this call knows that the economy was going to pieces because of all the subprime lending and what was going on with real estate and such. We've also experienced this incredible period of time of zero interest rates, and of course now we're all living through a very bizarre time of very high inflation, interest rates going up. Real estate prices were really, really high. Now all of a sudden they're starting to come down. So there's no panic here. Real estate from that perspective is going to go through its cycles, and there will always be moments in terms of when to attack and when not. Well, the best players and who know how to do this are the for-profit real estate developers and real estate funds. Now, there are some bad actors there. We had a loan in California with a private equity firm, and they said all the right things. And ultimately, they didn't deliver on what they were supposed to do with improvements for the complex that we financed. And we took them to task on it. And, that's what we would like to call maybe one bad apple. But I think more generally, you're starting to see a couple of different things. You're starting to see the next generation of leaders, even if they're private equity, professionals, if they're real estate developers, who are coming to the table, and they're all very socially minded, right? They have these social values. They want to make money, but they also want to have social impact, and they want to do social values, and that's very positive. That's a very, very positive situation. You asked about a specific situation. Again, I'll go back to Indiana. Here was a for-profit, family-run business. They owned scattered single-family homes in all over Indiana, and they had people with disabilities living there anecdotally. One here, one there, and such. And then all of a sudden, the state of Indiana, did a tour with us and with our client, and started to look at the homes and basically opened the spigot and said, "You keep doing this on the housing side, we'll provide the services. This is amazing." And the homes basically either had maybe 2 co-residents, 3 co-residents. Sometimes it was a family who had a family member with a disability. And it was great. It was absolutely perfect partnership, because the state of Indiana clearly didn't want to get in the real estate business. And in that case, it was a perfect combination of Olmsted being combined with practicality. So what that means is that on the actual lease is the individual, John Jones, Sally, Smith, whatever it is, they're on the lease. But the person who's handling the actual lease and everything else is the service provider who's acting as fiscal agent. So it's not a group home. It's not certified. These are people living on their own and have their own lease. So from an Olmsted perspective, it's fantastic, because it's meeting, the mission of somebody. But from a financial standpoint, it's easier for them to have a fiscal agent, and that's one of the service providers. So the state of Indiana is very happy, because they know that money's not being, wasted or lost or anything else. From the private sector standpoint, they know they're getting their, money. From our standpoint as the bank, so to speak, who's financing this stuff, we just go to sleep at night, because it's great. We know there's social impact. We get the data. And I must tell you, in this case, in Indiana, you have a lot of, we get all the data points. These are very low income people. Sometimes 30% below AMI, which is pretty amazing, and total diversity in terms of the nature of the residents. So anecdotally, we have these stories, and then we're starting to see the trends of who are the players coming to the table.
When we look at some of the nonprofits are doing some more innovative things, you got organizations. You mentioned St. Mary's. You got Omnium Circus, US Autism, Homes, Rise in Spirit, some of them. What other ones are you aware of, and what are the cool projects that you're tracking at this time?
Yes, so as I said, I mean, we've literally been presented with about 35 different projects from 16 states. I would tell you right now, one we're very happy with, that we're waiting in the wings to help finance, is out in Michigan. Here again, always parents driven. It's always fascinating to see, but families who probably could take care of their own young adults with autism by themselves, meaning they could buy their own house, they could deal with it and all that. But that's not where their mission is. Their mission is to try to get something for the community that really entices socialization and integration as well, and inclusion. So in this case, they're looking at acquiring a piece of property outside of Ann Arbor, where in essence they would like to develop anywhere from 40 to 60 units. They would sort of set aside sort of 20-25% of the units for quote unquote their children and others with autism and others, and encourage the other residents to be coming in there. So there's a nice inclusive community within a new build complex and such. So we're very, very excited. They're calling themselves sort of Independent Living Alliance, nice name, but more importantly, here you have parents who have some experience in real estate development, didn't really need us from a standpoint of learning real estate development. They needed us to understand, all right, so how do they have conversations with the state of Michigan on the service side, which is what's happening. There's a great example also, Ken, of great partnerships, because they are having conversations with this little thing called the University of Michigan, okay, this massive, school system that has all these programs going on at University of Michigan, whether it's, those learning, how to go into this field of service delivery, to urban planning, to all these different divisions, and they've brought them to the table. So they
That's
can
awesome.
help in terms of analyzing how's the impact going to be, and how do we sort of tie ourselves into this community. And that, you know, think about New York, think about the SUNY system, think about the CUNY system, think about, you know, all the amazing resources we have in this state. That again, when we talk about private, you know, public-private partnerships, it's even a little broader than just saying, you know, one-on-one transactions, you know, with the government or with OPWDD.
Well, we're pretty much out of time. I mean, this was a quick 45 minutes. I think it was one of the faster 45 minutes that I've had. So, Charles, I want to thank you for your perspective. I definitely love the passion, the vision. And if someone wants to get in touch with you, how can they go about doing that?
So hopefully everyone will go visit our newly revamped website. Very basic. It's www.thedof.org. You can just put in my name or whatever on Google. You'll find us. You just put Disability Opportunity Fund and you'll find us. But thedof.org. We have a click on where it goes to info@thedof.org. And I promise you, some of that goes to one of our staff. It doesn't go into a black hole. It goes to one of our staff, and we review those once a week. And we have really developed a lot of projects around the country just because people have contacted us on info@thedof.org. And when you're on that website, if people could spend a little time, go into the videos, because you'll see some of the projects we've done and the little stories that have been happening around the country, and you'll get a much better sense of what's going on. The key thing I will say, Ken, before we sign off, is we are not false prophets. We're not going to tell everyone here's the magic beans and the beanstalk's going to be built in 10 days. This is very hard work. And at the same time, this is what we've committed our lives to for the last 15 years, and hopefully for the next 50 plus, just to keep doing this, because there's a huge need. And we thank you for taking the time to commit a session like this to this topic. And, you know, we look forward to working with anyone who may need us.
It's incredible. So thank you, everyone, for tuning in today. We hope to see you next Tuesday, December 13th, and also on January 19th, where at 9 a.m. we're going to have our second and third parts of our board training series. More information will be found on our website, CeriniCPA.com. In addition, stay tuned, because we have our annual nonprofit trends report coming out in January. So until then, if I don't see you before then, enjoy your holidays and stay connected. Thanks, everyone.